There he is. How you going, bub?
Never better, Auntie June.
Hey, did you forget something? Mwah, good to see ya. So how's the pregnancy going, Kath?
Yeah, okay, Auntie, but I'm getting tired pretty easy these days.
I remember my first. Those last couple of months were the hardest.
I just can't wait to meet my bubs. Neither can ads.
The way this little fella kicks, he's gonna be some sort of footballer.
I just want him to be healthy, you know.
Of course you do. You're a mum. We just want our kids to be healthy and look after them. So, do you know much about infant first aid?
No, not really.
Because you know, sometimes accidents can happen and it's no one's fault.
Like when he's hurting himself when he's jumping for a mark.
Ads, be serious.
He's right. Kids fall over, they fall off stuff, get cuts and bruises from running around. Kids are kids, and it's important to know what to do if something happens. Have you thought about learning first aid for Bub?
No, we haven't, Auntie. But that's a really good idea and something I'd like to learn about.
Yeah, seems like something we should both know.
Yeah, well, knowing the basics will help you stay calm and handle any injuries that Bub might get.
That makes sense.
So do you know what to do if Bub wasn't conscious or wasn't breathing? Well, if Bub's unconscious or not breathing, the first thing you've got to do is make sure that you and Bub are safe. Then see if you can get any response.
A response, like a cry or something?
Yeah, just speak loudly or give them a little squeeze on the shoulder or tickle their feet.
What if nothing happens?
Then call 000 straight away. If you're on a mobile, they're going to ask what state you're in. Then they'll ask, where is the emergency and what is the emergency?
So like, I'm at 102 High Street, Shepparton, and my bub's not breathing?
Exactly. And they'll ask you some other questions too to pass on to the paramedics.
What if you don't know what's wrong?
Don't worry, they'll talk you through it. You might need to give Bub CPR.
CPR?
It stands for cardiopulmonary resuscitation. It can save Bub's life. Now, before you start doing CPR, you need to check to see if anything's blocking Bub's airway.
Like there's something in their mouth?
Or their nose or throat. It could be blood or vomit, food, loose teeth, anything that could stop air getting in.
So if something's there, you make sure to get it out.
Exactly. Now, CPR has two parts. The first is the compressions and the second is the mouth to mouth. You do 30 compressions to 2 breaths.
30 compressions, then 2 breaths.
That's it. It's called 30 to 2. And you need to do 5 sets in 2 minutes.
Wow, okay. 5 sets in 2 minutes? That's quick.
Is it the same as adults?
No, CPR for kids is different. You start by lying Bub on their back. To do chest compressions, you put 2 fingers in the middle of their chest on the lower half of their breastbone. And you press down by 1/3 of the depth of their chest.
A third?
Yep. If Bub's older than 6 months, then you might need to use your whole hand. Then you release the pressure and let the chest return to its normal position. That is 1 compression.
And I need to do 30 before I do the mouth to mouth?
Yep. Now to do mouth to mouth on Bub, first you need to make sure the head isn't tilted. You want their head straight and the neck to be straight, so you can get the most air as possible into their lungs. Then you lift Bub's chin. Don't rest your hand on their throat because it can stop air getting in, yeah? Take a big breath and cover Bub's nose and mouth with your mouth. Make sure there's a good seal, yeah?
Yeah, okay.
You just want to blow gently for about a second and watch for Bub's chest to rise. And then after each breath, you need to watch for the chest to fall.
So you can see the air coming in and out?
Exactly. Sometimes it's hard to see, especially in really little ones. So you lean down and put your face close to their mouth and nose. Then you can hear or feel the air coming out.
What if the chest doesn't rise?
Then check their airways again for any blockages. And if it's clear, do it again.
30 compressions And then 2 mouth to mouth.
30 to 2. And you're trying to do 5 sets of them every 2 minutes.
When do you stop?
You keep going until Bub recovers or the ambulance arrives.
And how do you know if Bub's recovered?
Well, if they start breathing or crying or coughing, then you put them in the recovery position.
The recovery position?
You turn Bub on their side.
What if they don't recover?
Keep going. That's really important. Even if you can't do the breaths, keep doing the compressions because it all can still save Bub's life. Just remember, any CPR is better than doing nothing.
So 30 compressions to 2 mouth to mouth, 5 sets every 2 minutes?
And don't stop.
Exactly. First aid is not just for saving Bub's life, but in an emergency, it can mean the difference between life and death.
Never really thought about it before, but I reckon this is really important. I should do a first aid course.
Too right you should. There's lots of places where you can go to learn first aid. And there's some information online too.
That's great information. Thanks, Arnie.
Thanks, Arnie June.
Good to know, yeah? At least it gives you guys peace of mind.
Yeah. Because the way he's moving, he'll be running and jumping before we know it.
This little one.